Hi everybody, Dr. Smith, MD3 here. I want to talk to you a little bit today about fevers. There's some little nuances about fevers I wanted to go over, kind of help maybe dive a little bit deeper into the science behind it. That way help you when you go forward with somebody with an infection, have a little bit better understanding of what's going on. So what is a fever? A fever is actually an elevation of the body's core temperature above a set point. So why do we say somebody has a normal body temperature, 98.6? That is actually regulated by the hypothalamus. The hypothalamus is just below the thalamus, thus the name hypothalamus, and it's a very small part of the brain right in the middle. On the picture on the slide, that's where it is. Just this tiny little point controls your body temperature and many, many other functions. So what is a normal body temperature? In Celsius, it's 36 to 38, and in Fahrenheit, it's 96.8 to 100.4 Fahrenheit. So a key distinction to make is that a fever is not hyperthermia. They're very, very different processes. So in fever is when the thermostat's actually turned up. Your body wants to go warmer. So the hypothalamus actually regulates you and goes from 98.6 to a higher level. Versus hyperthermia is an unregulated increase. That's where the body is too hot and the hypothalamus and the rest of your body doesn't want that, so it's trying to cool you down. So very, very fundamental difference. It's a subtle nuance, but it makes a big difference in treatment later. So let's look at hyperthermia versus fever. So while hyperthermia as a cause of an elevated temperature isn't near as common that we see in the field, there still are many, many causes of it. So when you think of high fevers or high temperatures and hyperthermia, think of like exertional or environmental. These are our athletes who are, playing football in, August in Florida. There's metabolic diseases. Traumas often cause high temperatures in the hospital. You may or may not see that in the field. Many medications can cause it, such as sympathomimetics, your stimulants, Adderall, illegal substances, drugs, methamphetamines. Those can all cause it. There are some medications that can cause serotonin syndrome that can cause a very high fever. Malignancies can also cause fevers too. So if somebody comes in and we've ruled out infection with a fever or high temperature, we'll start looking at cancers like leukemias. Now, when you think of an actual fever itself, I know I keep saying fever for high blood temperature, but that was hyperthermia. Fever, you want to think infection. Very, very few causes and very rare causes of a true fever without an infection, but that's really, really rare. So how does your body balance your temperature? It's really a balancing act. Your body is constantly producing heat and trying to cool off. So when you have an elevated temperature, it's because one of these factors has been offset. So the body cools many ways. There's environmental, sweating. I know it's a lot harder in Florida when it's 100% humidity and 98 degrees. That's why we see a lot of heat injuries here. There's respiratory, such as when you breathe in and out, your respiratory rate increases. That blows off hot air, helping cool you down. And then we have some innate systems where you start to get thirsty. That's why when you're hot, you want to drink more water. Sometimes there are innate things that like make you want to, take extra clothes off to feel better. Those are all things to help cool the body. Heating, there are a few other ways as well. Again, there's environmental. When you're cold, you want to put on clothes. You want to seek shelter, maybe by a fire. Those are all driven by your innate survival mode to get warmer. Metabolism is very important because when you're cold, your body actually increases its metabolism to produce more heat. So in a colder climate, people often have to eat more calories just to keep up their heat production. One of the big ways we produce heat is shivering. Shivering, just the vibration, the movement, the muscle movement, that produces quite a bit of heat, and that's going to help warm you up. So how do we actually get a fever when we have an infection? Well, we heat up with things called pyrogens. Pyrogens are just a class of molecules. So think pyro, fire, pyromaniac, pyrogens. So pyrogens are a group of proteins, bacterial products. Pretty much it's just leftover waste. Sometimes the bacteria produces stuff that your body responds to, but a lot of times just the simple fact of your white blood cells attacking some kind of bacteria or virus or fungus and chopping it up, those little pieces actually cause your body to respond and form a fever. So I put the word lipopolysaccharide. That's just a fancy word of saying part of the bacterial cell wall. Your body absolutely hates them. And a lot of the bacteria have very similar of these lipopolysaccharides. So your body can respond easily to many number of bacteria without having to change up its mechanisms. So what these pyrogens do is they actually feed back to the hypothalamus and cause your body and change the thermostat. It changes that set point. Now, how do we actually raise the body temperature? Well, it causes the blood vessels in your skin to vasoconstrict. Now you think, well, how does that cause a fever? Well, your blood is very, very hot, and one of the ways that we actually lose heat is by sweating, and we increase blood flow to the skin to get that hot blood to the skin where it can kind of dissipate out. But when we vasoconstrict, it moves all that warm blood towards the middle of your body, so that can raise your body temperature. We also have what's called piloerection. That's where the hairs stand up. So if you've ever had goosebumps, that's piloerection. Now, this one isn't so important in humans because we don't have a lot of body hair, but in our animal friends, this is one of the ways they get fever, and it helps really control their body temperature. One of the main ways we get a temperature is increased heat production. So, like I said earlier, we have shivering that produces a lot of heat. So whenever you have a cold or the flu, you get the shivers and the chills. That's why. We also have increased sympathetic activity. So your body's natural epinephrine, norepinephrine, things like that, they're ramped up. So you're getting a increase in your just fundamental metabolism. Again, the metabolism does increase, so we have more calories produced or more calories consumed, and that's going to increase heat. Because again, what is a calorie? It's energy fundamentally connected to heat. So that's why when you're sick, have a few extra calories. Don't worry about eating that Big Mac or whatever makes you feel good when you're not feeling well. So why is a fever good? What does a fever actually do for your body that is protective? So first off, there's the metabolic effects. So when your metabolism increases, you have increased need for oxygen. So you have an increased heart rate and respiratory rate. So this is why you see people that have tachypnea, tachycardia, and a fever. It also increases your protein metabolism. Your body uses various different products for energy. So it can go from glucose to fat and protein. So normally when you're sitting there resting, having a good day, driving in the car, you're using mostly glucose for your energy. However, if you have a bacteria, what does bacteria also like to use? They like to use glucose as well. So your body has this pretty neat trick that when you have a fever, you actually start storing more glucose to keep the food away from bacteria, and your body starts using its own fat and protein. So this is one of the ways your body can kind of help to try and starve out the bacteria but keep you fed. A lot of effects in your immune system in response to a fever. The temperature increase actually increases activity and movement of white blood cells. So this mobilizes them from their storage sites going to the site of the infection. It also stimulates the activation of different cells. When we say white blood cells, we're talking about a class of cells. There's many, many different types of cells with different jobs within a white blood cell grouping. So this will help to activate different ones of those specific to whatever type of infection you have. Or if it's a reinfection, maybe it activates memory cells. Temperature also helps to inhibit microbial growth. Why is it we see common bacteria repeatedly in the human, but we know there's millions of bacteria in the world? Well, those ones that can live in the body and cause infection are the ones that thrive at body temperature. You're not going to get one of these hot springs bacteria in your body. It would die immediately because our bodies are too cold. So when your body heats up, that helps to kind of slow down and try and kill these bacteria, because bacteria, just like humans, like a very narrow range that we want to keep our bodies at. And actually, a little tidbit, the very first treatment for syphilis was giving somebody malaria. Malaria is one of the few bacteria that causes a very, very high fever to 105, 106 Fahrenheit. And syphilis is extremely sensitive to temperature, so we could actually kill the syphilis bacteria by giving somebody malaria. Now, we all know fevers aren't all good. So why are fevers bad? So fevers cause a number of changes at the cellular level. So when you're looking at the smallest units of a person, they cause blood loss, little tiny hemorrhages, not just like what we think of hemorrhage bleeding out, but like little hemorrhages all over the body, particularly in the brain. The brain is incredibly sensitive to temperature variations. So when the temperature goes up, just like the bacteria want a certain temperature, our proteins love a certain temperature to have all of our chemical processes running. So as we warm up, these proteins start to unwind or denature. They can't form their functions. Things start to go awry. We also have the release of toxic compounds. Just like everything else, we produce waste, our cells produce waste, and we like to keep that stuff set aside. We like to keep it compounded until our body can get rid of it safely. Well, when temperature goes up, some of these toxic compounds release. Specifically, I listed cytochrome C and capsaicin. These are very, very important in what we call programmed cell death or apoptosis. We want cells to die when they're supposed to die. If they go unregulated, then we can start talking about malignancy or cancers. But when the temperature goes up, all these nasty things, these toxic compounds, they start to get released. The proteins denature. You have these little small hemorrhages locally. in the area we're looking at. This ultimately leads to mitochondrial damage. Now we can't produce energy. All this combines and you end up dead. So fevers can be very deadly. So how do we assess for a fever? Obviously we check a temperature, but they're a little, it's a little bit more complex than just putting a thermometer in the mouth. Every single site is different. So if we look at the oral and call that the base, that's going to be your 98.6 is your average temperature. Now, if we look at other ways that are checked in medicine, rectal temperature is usually a half to 1 degree higher than oral. The ear, the tympanic method, is similarly a half to 1 degree higher. Your axillary and your temporal will actually be a half to 1 degree lower than your oral temperature. So it's important to keep these differences in knowing what's a fever. Really, we like to use core temperatures in medicine. That's the absolute gold standard. We're talking about rectal thermometers, bladder probes on Foley catheters. They even have temperature sensors that you put in the esophagus and leave there. But again, you don't really want to do any of that pre-hospital, so let's just stick to the routes that we use now. So how can we help to manage fevers? I suggest to you that one of the most important things you can do is get a very accurate history. This is critical. You want to start general. You want to ask what's going on today. You want to ask how are you feeling, what kind of symptoms are you having. Same thing we do every time. But then when you get focused, you really want to get the details. The timing of the fever is really important. How long have you had the fever? Is it all day? Does it go up and go down? Is there certain times a day you have fever? Like if you have a virus, probably going to have a fever all day. If you have malaria, you might have fevers every night at 5 p.m. that goes away. How did you check your temperature? Did you do it orally? Did you do it with a forehead swiper? Are there any new symptoms with the fever? Are you noticing any cough, shortness of breath, sore throat, pain or burning when you urinate, rashes? Rashes are actually very important in fevers. And also you want to ask, especially when kids that can't give you a history and asking for mom, how are the symptoms changing? Did they have a fever for 3 days and now they look like they're knocking on death's door? Yeah, that could be maybe mean that the fever is changing. Like sometimes you have a respiratory infection and then move to bacterial tracheitis where it's a very deadly disease. So especially with kids, you always want to talk about how are things changing as their symptoms progress. So let's talk about fever with kids. There's a few considerations you want to have in mind just to be safe. Kids are susceptible to different infections than adults, but also a lot of the same infections as adults. So you're getting a lot of infections plus some more. So they have a developing immune system. When a child is first born, the immune system mainly comes from their mom. As that starts to go away after a month or two, their own immune system starts to ramp up and they're constantly changing. So kids will be sick half the year, it seems like. They often have a risk for different or rarer infections because they might not be fully immunized or they're only partially immunized. So maybe the mom and dad have decided not to vaccinate. We'll get into that's not a discussion for another day. Or they've only gotten half of their vaccines because of their age. So you always have to keep in mind rubella, other things like that we would all be vaccinated against. They also have changing anatomy and needs. As kids grow, kids have giant heads compared to their bodies. As kids grow, their anatomy changes, therefore, the sinuses may expand and they're less susceptible to sinus infections. Anatomy is very important, especially in like our patients that have physical disabilities. I know a Down syndrome, because of their facial abnormalities, they're increased risk of sinus infections. Especially with kids in diapers, they can have increased risk of like urinary tract infections just because we have all the human waste going in one place, sitting next to the skin. Always do a good history of their eating and their diaper habits. Kids can't regulate their temperature as much. They have a large surface area compared to their body size. They can lose heat very easily, so they're much more. So it's easy to have a high temperature from environmental causes, less likely infection. They also have a developing brain, so constantly being changed. Their blood-brain barrier hasn't fully developed, so increased risk for meningitis. A lot of things that can happen in children. They also have an increased risk of long-term complications. Fevers can cause Kawasaki's disease, which can be dangerous to the heart. Children with certain upper respiratory infections can later on in life develop rheumatic heart disease. Luckily, thanks to modern antibiotics, this is becoming a very rare condition. So with kids, the history is key. You can tell all these things. You're not going to be able to tell by talking to a 6-month-old. They can't talk, but the mom giving the history will be the clue to all of it. Who else is susceptible to fevers? Our old people. Often the elderly have a very poor physiological reserve, and the way I think of that is they just don't have as much gas left in the tank. When it takes you a little bit of energy to get up and go for a walk, it may be everything that an elderly patient has, all of their energy just to go for a short walk. So they don't have near enough left over to help fight these infections. Oftentimes the elderly will have a lower body temperature normally, so if they live at 96 and they come in with 98, 99, while it's not technically a fever, it may be high for them. Their history, again, just like children, may be limited. Maybe they have cognitive defects or dementia, things like that. They may not even have any fever because they have altered response to infection. They come in with a normal temperature, but they may be altered. Oftentimes we see urinary tract infections as a very large cause of altered mental status. They have multiple comorbidities: diabetes, heart disease, high blood pressure, cancer, chemotherapy, radiation, things like that, all increase risk of infection and help to blunt the response to the infection. Also, I didn't put it on the slide, but our elderly people may have certain medications that will lower their ability to fight fevers. Again, immunosuppressive agents if they've had a transplant, or even just like thyroid hormone can lower or raise the body temperature. So always take a good medical history to see if any of these medicines would affect how your body responds to a fever. So how do we approach the management of a chief complaint of a fever or an infection? So the very first thing to do is actually recognize an abnormal body temperature and ask if this is from an infection or other possible source. And it can be harder than you think. You take a temperature, it may be normal, maybe high. Ask if they've had anything to eat or drink recently. Make sure we get a good temperature, because hot coffee, cold drinks, they can affect the way we check temperatures orally. Get a good history. Like we discussed earlier, history is often key for the fever, much less important than the physical exam. This is going to help to guide management at hospital and pre-hospital. And I really ask that you get a great history, because oftentimes hospitals are not allowing the family to come in there. We're having to call them on the phone. So we want you, any history you can get from a guardian or parent, especially somebody who can't communicate with us, is very, very important. And I really appreciate when a medic or EMT comes in with a great history and can tell me what the family said. That makes a critical difference in the hospital. Provide early interventions if you suspect infection, especially fluids and pressors. So if somebody has a fever and you're worried about infection, well, what do we call that? We call that sepsis. So what actually is sepsis? So I'm going to skip ahead a little bit. Sepsis is SIRS criteria, 2 or more SIRS criteria, plus a source of infection. So SIRS is systemic inflammatory response syndrome. So systemic, whole body, inflammatory inflammation response syndrome, clustering of symptoms that seem to run together. So it's just your whole body has inflammation. That's what it boils down to. So the criteria right there, but it's a temperature, basically it's hyper or hypothermic, so over 38 Celsius or less than 36 Celsius. Heart rate over 90. I know that we use tachycardia, is usually around 100, but for SIRS we use 90. Respiratory rate over 20, or a PaCO2 less than 32 millimeters of mercury. We're not going to check that so much in the field, but tachypnea is important. A white blood cell count over 12,000 or less than 4,000, or greater than 10% bands. Bands are immature cells that are starting to grow, so if we see more bands on the blood smear, that means that the body is increasing its white blood cell production. So for us, I want you to know the medical operations manual, because clearly some of these are lab values that we can't get pre-hospital. That's why our local sepsis criteria are based on local factors and SIRS criteria that you can see above. So you probably recognize most of those SIRS criteria in M9 for suspected sepsis. Treatment of sepsis or fever pre-hospital. Again, first you have to have suspicion of infection. Ask yourself, is this an environmental cause? Is this a drug that caused the high temperature, or is this an infection? Once you suspect infection, early fluids are very important. In the hospital, if somebody is in septic shock, we recommend 30 cc's per kilogram of isotonic fluids like normal saline or lactated ringers. But this is more for septic shock. So again, begin fluids early. If your patient is hypotensive, always follow M9. We want to give plenty of fluids. Consult online med control as needed, because we're definitely want to be here for you and help to guide you in this. But fluids are key very early in an infection. Now, sometimes we use caution in the hospital, or we want to give less than 30 cc's per kilo. Maybe they're hypertensive, they're not in septic shock. Maybe they have a history of fluid overload status, CHF, cirrhosis. Kids with some congenital heart diseases, they can be very, very fluid sensitive. So if you ever have any concerns about somebody's fluid status, please contact Online Med Control. We're happy to talk through with you. So again, fluids early are key. I hope I've said that enough, but fluids. Now, after fluids, if they're still hypotensive, then we want to start considering pressors, especially norepinephrine. Now, a side note, there are some new guidelines coming out in the next few years. We use what's called the Surviving Sepsis campaign, and that's a consortium of a lot of really smart people that are way smarter than me, and they come up with the best way to treat these medicines. There is some rumblings that maybe pressors and fluids are going to be started at the same time later, but for now, let's stick with the protocol, and we're keeping an eye on that constantly, and we will update that and get that out to you as things change. So, if antibiotics are so important in infection, why don't we give them pre-hospital? There's a few reasons. So first off, there's safety. So allergies are very, very important. Anaphylaxis, obviously deadly. Allergies can limit the selection of the antibiotics that we can use for an infection, and they can increase adverse events. So local reactions can occur. If you've ever seen anybody with red man syndrome, it's a reaction to vancomycin. It's not a true allergy, but it can be very irritating. So we have to be very, very careful in which antibiotics we select to make sure it's safe for the patient and appropriate for the infection. There's also the time it takes to give antibiotics. Often antibiotics have to be given over 30 minutes, an hour, and for our relatively short runs here in the county, that's not so much of an issue. Cost and storage, they have limited shelf lives. A lot of them require refrigeration. Some of them require reconstitution from a powder. So again, there's just the actual logistics of holding these antibiotics are very difficult, and therefore make it less important or less feasible to give pre-hospital. There's also future studies that are very important. When somebody comes to the emergency room, oftentimes cultures, blood, urine, wound cultures, whatever you're culturing, are very, very important to help to guide management. Especially somebody that has chronic recurrent infections, we need to know what bacteria it is and what is it resistant to. So even if you give an antibiotic that might not work for the bacteria, it can still stop it from growing in a culture. So we really want to have good cultures in the hospital, and it can save a life. There's also the side effects of the antibiotics, like we say with black box warnings. This is different than safety. Side effects would be like fluoroquinolones they can cause tendon rupture. I had a young man come in who was playing basketball. He just got done taking a fluoroquinolone for an infection, and he had an Achilles tendon rupture. So again, there's a lot of effects that can come from a medicine that goes into the choice of it. So for all these reasons together, and combined with our relatively short transport times, just a few minutes, holding on antibiotics during transport shouldn't make a difference in the outcome. All right, guys, just a few more little tidbits about fever and sepsis. So the management of sepsis is constantly changing, so expect updates to the Medical Operation Manual in the future. We're constantly surveying professional society recommendations, updated literature, to make sure that we have the best updated information to help manage our patients. Now, a word on Tylenol, ibuprofen, and aspirin. Why do we give those in fevers? Well, they actually inhibit the enzyme cyclooxygenase, or it's abbreviated COX, and there's different forms of it. There's COX-1 and COX-2. By blocking this protein, it inhibits the formation of prostaglandin E2, PGE2. So PGE2 is one of the main compounds that goes back to the hypothalamus to help to raise the body temperature. It raises that thermostat set point. Interestingly enough, prostaglandin E2 has very little to no effect on body temperature without an infection present. Now, I also want to point out normal temperature is going to vary between people and throughout the day. So if you wake up with a temperature of 97 and go to bed with a temperature of 99, still not a fever, that's just normal daily variation. Thanks for watching, everyone. I hope this was a little informative and helped to kind of understand what's going on in the body when you get an infection. Again, I just want to reiterate, fluids and pressors are key in an infection. And if you have any questions or concerns, feel free to contact me. Always happy to help out any way I can. Thanks and have a great day.